Do your gums bleed when you brush? Many people think it's just a little bleeding, it must be normal, but the truth is, it isn't. Bleeding gums are one of the earliest warning signs that something isn't right. In the next 5 minutes, I'll explain why your gums bleed, what it means, and the simple steps you can take to stop it. Let's get started. Hello, I'm Dr. Ankit Arupadhyay. Welcome to Urban Smiles Advanced Dental Clinic in Sector 26, Noida. Bleeding gums are one of the most common concerns I see in my practice. The good news is that in most cases, it's completely treatable, especially when you catch it early. Let's understand what's really happening. The most common reason your gums bleed is a condition called gingivitis or early stage gum disease. Here's how it starts. Throughout the day, a sticky layer called plaque forms on your teeth. This plaque is full of bacteria. If it isn't removed properly through brushing and flossing, it begins to irritate the gums. Over time, your gums become inflamed, swollen, and sensitive. That's why they start bleeding when you brush or floss. Many people assume they are brushing too hard, but that's usually not the reason. Brushing too aggressively can cause gum recession. Bleeding gums, on the other hand, are most often a sign of inflammation caused by plaque and bacteria. Think of bleeding as your gums asking for attention. Let's clear up one of the biggest myths. Bleeding gums are not normal, and they definitely don't mean you should stop brushing. Many patients tell me, "Doctor, my gums bleed, so I avoid brushing that area." Unfortunately, that makes the problem worse. Less brushing allows more plaque to build up. More plaque leads to more inflammation, and more inflammation means more bleeding. The solution isn't to avoid your gums. It's to clean them properly and treat the underlying cause. So, what should you do? Here are 3 simple steps you can start today. First, use a soft bristle toothbrush. Brush gently using small circular motions. Avoid aggressive back and forth scrubbing. Second, floss every day. Your toothbrush can't clean between your teeth. That's exactly where plaque loves to hide. Daily flossing helps remove bacteria before they cause inflammation. Third, don't ignore persistent bleeding. If your gums continue to bleed for more than a week, even after improving your brushing and flossing routine, it's time to visit your dentist. You may have hardened plaque, also called tartar, and once tartar forms, it can't be removed with a toothbrush. A professional dental cleaning is needed. Here's why early treatment is so important. If gingivitis isn't treated, it can progress into a more serious condition called periodontitis. At this stage, the infection starts affecting the bone that supports your teeth. Over time, teeth may become loose. Eventually, they can even be lost. The good news is that bleeding gums are usually the earliest warning sign. Treating the problem now is much easier, more comfortable, and far less expensive than waiting until it becomes severe. If your gums have been bleeding, don't ignore the warning signs. A simple dental examination can identify the cause and help prevent bigger problems in the future. At Urban Smiles Advanced Dental Clinic, we'll carefully assess your gum health, explain what's happening, and recommend the right treatment for you. In many cases, a professional cleaning is all it takes to restore healthy gums. If you're in or around Noida, we'd be happy to help. Book your appointment today. Thank you for watching, and I'll see you in the next video.